Yeah, so hi everyone, welcome to Power Corridors. Today we have a special guest, Dr. M. Santosh Kumar Gupta. He's a certified medical coder from USA and Australia, and he's the CEO of the Medesun Medical Coding Academy. He has 45 certifications in medical coding and health information management. 3 world records are against his name. And he has a 21 years experience and he has trained more than 30,000 medical coders. Thank you so much, Dr. Santosh, for joining us today.
Hi, actually, thank you for giving the opportunity to discuss more about the medical coding.
Yeah. So I will start with what is medical coding. Can you tell our viewers?
Okay. Okay, fine. So medical coding means assigning the medical codes for the medical records. See what happens, in the developed countries like USA, UK, Australia, Italy, Spain, Germany, etc. The health insurance group is provided by the government or private sector. So the entire healthcare is controlled by the government or the private health insurance. So these insurance companies, they want the medical codes for each and every medical record. So for example, assume patient came to hospital with some chest pain, right? A physician taken an ECG and given some medication. Assume the fee is around $200. In India, what we do, we don't have any medical coding. We pay cash, simple, right? But in USA, what happens is, insurance company, they want the medical code for chest pain, medical code for the ECG, and the code for the medication given to the patient. So based upon these codes, they provide the payment to the physician. So without medical coding, physician cannot be reimbursed, physician or hospital or any provider, right? So medical coding is mandatory. So what is coding means? Assigning the medical codes for diseases, procedures, and supplies and drugs given to the patient. So approximately there are more than 1.5 lakh codes are there in the trials with WHO. 1.5 lakh codes. So for diseases we have 74,000 codes. For procedures we have 74,000 codes. In drugs we have 12,000 codes. Like this we have a lot of codes. And based upon the medical record documentation, we assign the codes and submit to the insurance company. That is called medical coding.
So how medicine is involved in this, in medical coding?
Okay, so generally, basically, actually, I'm a medical doctor. I finished my graduation in the year 1999. In 2004, I first went to USA to learn medical coding, almost 20 years back. When I went to US to learn medical coding, I thought I do medical coding only for time pass for 2 or 3 years. But I've seen, even today also I'm doing medical coding. Even next month I have one more exam. I'm going to get one more certification.
So you are still in the learning phase of your
Yes,
life.
because healthcare is such a wonderful field where you have to learn more to earn more. Okay, so in 2004 I got first my CP certification. Then I worked in the US for 7 years as a medical coder, as a medical coding auditor. When I came back to India, I came to know that there is huge demand for the medical coders throughout India, and you won't believe, medical coders' income is more than the software programmers, almost equal to software programmers. They make more than 2 to 2.5x per month. The experience of 5 to 6 years. Freshers take a salary of more than 30,000, 25,000 per month. So because demand is more, in 2009, I started my own company called Medesun. So at Medesun, we provide medical coding training, medical billing training, training on the health information management, and we empower the students with the knowledge and the skill, and we help them to get a better career. So since 2009, we trained more than 30,000 coders throughout the world, and luckily 98% coders are now certified, and they got the job also.
Okay.
So Medesun is more with medical coding training, both offline and online.
So we have discussed about medical coding. So now what is medical billing?
Okay, it's a very good question. So see, medical coding means assigning the medical codes for the medical records. Okay, now what happens here is, now insurance company want to know what is the patient name, patient age, insurance ID, patient address, a lot of things they want to put the patient demographics. So as a medical biller, what they do is, they extract the patient medical demographic information, and they create one claim form. In that claim form, they enter the patient details and the medical codes given to the medical coder. They validate the patient demographics and the medical codes. They validate the insurance, whether it's payable or not, whether it's covered or not. They go through almost 50 to 60 checkpoints, and then they create the medical bill called claim form and submit to the insurance companies. So once they create a clean claim form with all these checkpoints, then the insurance company provide payment to the medical biller. So medical biller plays a major role here to create the claim form, nothing but the medical bill, and submit to the insurance companies. And also they work very hard to get the payment from the insurance companies to the provider.
Okay. So you have 45 certifications against your name.
Yes, sir.
You are a world record holder. So
Yes,
how was your journey? Can you tell our viewers?
Okay, so see, sir, actually, I said when in 2004 when I got my CPC,
Yeah.
I was very excited. I thought, okay, I have to learn more first of all. Then I understood that to teach students properly, you have to get more knowledge. So unless you are perfect in any particular field, you can't become a trainer, right? So with that passion, I learned all medical coding certifications. I've done all like CPC the first step, then I've done CCS from Mahima, cardiology coding, pulmonology coding, pathology coding, oncology coding, everything. Now I'm in a stage where I learned everything. I done coding of millions of records. With this skill, what I have now, I'm training the students. No, so we have 50 trainers in my company, and I train them properly to become trainers. So I believe in one thing: see, the knowledge and the money, if you don't share, it's of no use. So what the knowledge I got all these days, the skill I got, so I'm sharing to everyone, and everyone's getting the job, and that's making me to study more and teach more. And if you see here, now healthcare is a trillion-dollar industry. You can see India, we have more than 10 lakh medical coders. And shortly, within next 4 to 5 years, India also going to start in medical coding in private sector also. India already started coding in the government sector. They're going to start in private sector also. So see the demand. So for this demand, we require the best trainers. So to be the best trainers, I'm learning more. So I got all certifications. Yeah.
So now, what is the scope of medical coding and medical billing in India, if we talk about?
Okay. So very good question, sir. Medical coding is a huge scope. See, now students, once they undergo training for 6 months, it's a comprehensive training, 4 to 6 months. They go to any medical coding billing companies like healthcare BPO. Starting salary will be 18 to 25K per month. As they get the experience, maybe 2 or 3 years, it may go to 50K per month. Experience of more than 7 to 8 years, salary is more than 1.5 lakh per month. See, every medical doctor in USA, every healthcare provider, the pharmacy, the lab, they require a medical code compulsory. Without medical codes, you can't get the claim reimbursement. So imagine the requirement of manpower. I know, in US we have very less manpower. No, India is advantage that India has more young people, 28 years average age. We are more hardworking, ethical. We know English, and nobody works in the world with the way how we work, the ethical and with compliance and hardworking. So definitely, Americans they love Indians about the medical coding. I've seen since 20 years. For 20 years, I've seen as of now, work is coming day by day, is coming increasing day by day, and they trust our coding capability, and with our accuracy and precision in the coding, they're very happy. In the future, now once you get training, you're working for American doctors, even from Australia, even from Germany, Netherlands, Switzerland, all developed countries, Canada, they're going to outsource to India because India is the hub for the medical coders. Like how IT is a backbone for the entire world, medical coders, like I said, the Indian coders are the backbone for the entire world. So scope is very, very high. And not only the working for American doctors, even now under the ABDM, Ayushman Bharat distribution. Under ABDM, we have a system called Ayushman Bharat. It's a free healthcare for the poor people. Very good initiative. Under Ayushman Bharat, once they implement throughout India, I'm sure every hospital in India requires medical code is compulsory. And even the CBHI, Central Bureau of Health Intelligence, they're working very hard on the medical coding. They're doing the coding for the government hospital, they're getting statistics. Imagine if we do coding for entire private sector, every pharmacy lab, we get wonderful data. With this data, we get a lot of benefits. We can prevent the disease spreading, healthcare transparency, and we can control healthcare cost and prevent the fraud abuse. So overall, medical coding is a part of healthcare system. So future is very, very high. And trust me, in next 3 to 4 years, demand is going to be double in the India. So as long
So,
as
yeah,
people are the needs are there,
yeah.
coding is mandatory. It's a part of the system.
Yeah, so you talked about the skilled labor and the skilled medical coders in India before this question. So I wanted to ask the skill development initiative by the government of India, how medicine is involved in that?
So actually, sir, okay, a very good question. See, medical coding is a highly skilled job.
Yeah,
So just if you simply pass some certification exams of no use, it's a piece of paper only.
yeah,
Any company, they give job based upon the company exam, what you have to pass company exam. This is the skill. You
yeah,
can't bluff the any company. I say it's like chef job. I take certificate of chef, but if I don't cook properly, I won't have the same. Okay. So it's highly skilled job. So
yeah.
at medicine, we train students more than 4 to 6 months. We
Hmm.
expose them to 3,000 question bank where they get proper skill.
Okay.
Not only at medicine, we also partnered with the task. Task means Telangana Academy for Skill Development from
Okay.
Telangana government. So
Yeah.
from the task, we trained more than 10,000 medical student graduates, and we do workshops every on and off for the performance students. So
Okay.
ultimately, we focus on the skill only, not on the knowledge. So once you have a skill, no, that's fine. So you can serve anywhere. You should be still smart in the medical coding. Yeah. So we're putting all the efforts for taking help of the government, Telangana through task, and also from the public-private sectors, and helping the
Yeah.
people to get the good job. Yeah.
So, are there any shortcuts to clear this medical coding exam?
Okay, so very good
So,
question,
because
sir.
the students
So
students
yeah, I
find the
know.
shortcut nowadays, you know.
No, no. See, that's what. There
Yeah.
are no shortcuts for medical coding exam.
Yeah.
Highly impossible. But people they do a lot of things. But what I suggest is don't go for shortcuts because okay, assume you went for shortcut, you passed the exam. What's the use? Tomorrow you
Yeah.
have to work
You
for
don't have
American
the proper
doctors.
knowledge on
Knowledge,
this.
skill. See, if you do
Yeah.
mistake, no, what happens? They lose the money. See, it's a bad name for the country, not for you, not for the company. We get
Yeah.
the bad name. See, 20 years, such a wonderful, lot of work is coming. Lots of people are employed. We're so
Yeah.
happy. If we pass this the wrong way and do wrong work, no, we lose the work, we lose employment. It's a bad name for the country. So we don't encourage all those things. And if anybody's there, just call me. I'll book a. I'll make them behind the bars. So it's not possible. But
Yeah.
I suggest don't go for this all these things. Study, practice. Again, I'm telling, exam is not mandatory.
Hmm.
You go to any company, the company says, pass my company exam, clear my exam. I'll give job for you. Even if you get 100% marks in the certification board exam, nobody cares because it's a skilled job.
Yeah.
So focus on the skill. So there are no shortcuts for the medical coding exam. You should do a lot of hard work. Yep.
Okay. So, what are the benefits of medical coding?
Okay, sir, medical coding has so many benefits. So I'll tell you one thing. Before COVID-19 pandemic, demand was very, very huge.
Hmm.
After COVID pandemic, demand was abnormal now. There is
Hmm.
more demand, there is less supply. Why? Because see here. Okay, so I'll ask one question. Do you know what's India population approximately? Around 140 crores,
140
right?
crores? 140
Okay.
crores, yeah.
Now I'll ask a question. In 140 crore population, yesterday, how many would have went for treatment? Can you guess? Maybe 1 crore would have went for treatment, no? Assume.
Maybe approximately 1
No.
crore or 2 crore, yeah.
Okay. Now in this 1 crore people, how many people has diabetes? We have any data? No. In 1 crore people, how many people has cancer? How many got road accidents? How many went to the private labs? How many went to the government labs? So
You are
we
saying
don't have this
on a daily
data.
basis. You are saying on a daily
Yes,
basis.
yes.
Yeah.
Yes. So daily, weekly, monthly, we don't have, CBHA from the government of India, they're doing the work. They did it from government hospitals, but the private hospital, they're not doing the coding. So when you don't do the coding, you won't get the data. When you don't get data, how do you control, right?
Yeah.
So nowadays, with the initiative of CBHA and the government of India, coding is done by the government hospitals. But private doctors, they're not doing. If everyone does the coding, we get wonderful data and helpful for the disease, public health improvement.
Probably.
And use for
Yeah.
the clinical research. And you can prevent the fraud abuse, healthcare transparency. And not only that, we can we can do a lot of cost control in the medical field, right? So
Yeah.
medical code is the only way where you get the data collection.
So, if the students, they try to come in this field, what are the salaries in the medical coding field.
Okay, so for a skilled medical coder, starting salary will be we can say 18,000 rupees per month to 25K per month, depend
Okay.
upon location, right? Like in Hyderabad, they pay 25. In some
Hmm.
places, they pay 28, 25 like that, 18 like that, right? But after 1 year, they get 30% to 40% increment because they get the life experience.
Okay.
On average, with the experience of 5 years medical coder, they get salary of 1 lakh
Hmm.
per month, 80 to 1 lakh per month.
Hmm.
Depend upon the more certification, the more skill. If depend upon the management skill what you have, it may go up to 2 lakhs per month. So I can say 18K to 2 lakhs per month
2 lakhs
within
per month
10 years.
within 10
Average,
years.
they land up to 80 to 1 lakh per month.
Okay. So, according to medicine, what are the training methods that you use for your medical coding trainers
Okay. So I said the
and the
medical
students
coding
as
as a
well, and
skill
the
job.
student? Yeah.
Yeah. So we provide training in two ways, both classroom training, online training. So our major is online training. So we connect the student to Zoom call. We
Okay.
curate the material to the students,
Hmm.
and we take the class every day through Zoom, maybe 2 hours per day. After
Hmm.
the class, we provide the questionnaire for them. We have a WhatsApp group, and where they ask questions, we clarify the questions. Like this, we give training for 2 to 3 months.
Okay.
After 3 months, 1 month they have daily exams. Imagine you take training for 3 months, 2 hours per day, 5 days a week.
Hmm.
1 month every day you get to the exam, automatically you get the skill. And the
Hmm.
fifth month, what we do is we prepare for the board exam.
So you give both, the live experience and the
Yes,
online experience. You give
yes,
both.
exactly. Yes, and at the
Okay.
sixth month, they go for the board exam, ready for interview also. So this is a strategy what we have, and we provide its own question bank, our own proprietary
Hmm.
material, updated material,
Hmm.
and as per international curriculum. So
Hmm.
this way, student get the proper knowledge and the skill, and they get job ready. Yes.
Okay. So, what is the differentiator between the medicine, healthcare, and others? What's the special about your training?
Okay, so I can say medicine. Okay, first of all, I take care of training. So, I have already got older and I've done a lot of certifications. I know what is what about the coding. I have the best trainers in India. And the major thing is here our own good material.
Hmm.
And the strategy what we use for the coders is very good because we know exactly how to train a student. We have a strategy.
Hmm.
Every student is same to me. It means if I take 30 members batch, I want all
Hmm.
30 to get the exam and get the job. We focus
Okay.
one-to-one focus will be there. We have very good trainers, and we
Hmm.
have a system. We have a robust LMS. It is called Learning Management System, and
Hmm.
everyone going to get the access.
Hmm.
24/7, we have WhatsApp support for the students, career
Okay.
guidance. So
Hmm.
once they step into medicine, they go with the job
Hmm.
offer. Yeah.
So, what is the scope in abroad, like the abroad jobs and
Okay. So
anything? The if the student wants to move to abroad, how medicine is helping in that?
okay. So it's a very good question. Very good question. See here,
Hmm.
uh, in the USA, demand
Hmm.
is more, but
Yeah.
with the certifications of what we pass, you won't get America. It's not possible. But
Hmm.
if you go to USA, this is useful. You got
Okay.
the point, right? Okay,
Yeah.
so you went to US as a student or dependent, then it's useful in the US, right? But in the Middle East, like Oman, Qatar, Bahrain,
Hmm.
Saudi Arabia, Dubai, Abu Dhabi,
Hmm.
demand is very, very high. You clear
Hmm.
the exam in India, and immediately you get job. Middle East jobs are ready for you. So I can say here, with the certificates of what you pass, you get job in Middle East immediately. But America is not possible,
Hmm.
and the rest of the country you have to write the company specific exam. But
So,
for against
yeah.
abroad, India itself has very good opportunities because
Okay.
when you get salary 1 lakh per month,
Hmm.
I say that better don't go to anywhere. So work in India happily, right? Try to
Yeah.
improve the skill and get to 1.5 lakh salary per month. Yeah.
Yeah. So, what is the difference between a medical coder practicing in India and medical coder practicing in the US? Who is more
Okay.
skilled?
See, excellent questions. Actually, see here, the medical coder in USA, they work with the doctor's office or hospitals
Okay.
closely, right? But in India, we work for companies. You got
Okay.
the point, right?
Yeah.
So they also the work to India. That's why we say that when you work in India, you have to learn a lot of things. Why? Because when you're working in America, doctor is next door. You can ask doctor your clarifications. But
Yeah.
when you're working in India, you should have a lot of knowledge, right? So
Yeah.
that's why we tell you have to learn a lot of things. So the work difference is there. The style of working is different. The accountability is different when working in India and when working in USA.
Hmm. So, what about the job security if we talk about it,
Sir,
compared to India or the Middle East or the US or the Europe?
okay. If we come to medical coding field, retirement happens in medical coding. Retirement will happen. No need to change the field. You take my case, sir. My
Hmm.
kids, they're doing medical coding now. I trained
Okay.
3 generations of medical coding. I never thought
Okay.
25 years, 20 years I'm going to medical coding now. I'm going to do for next 30 years also, right?
Uh,
My students are there working since 15 years.
hmm.
See one thing, Harish, once you get the lot of, once you get the career, job
Hmm.
satisfaction,
Yeah.
no stress, salary 1
Hmm.
lakh this month. So
Hmm.
retirement, you retire happily with the medical coding only. And good thing is in medical coding, you have
Hmm.
work from home opportunity, work from home also. A lot of
Okay.
my students are there with experience of 2 to 3 years, they work from home
Hmm. Hmm.
and they make a lot of money. So they start working at 6 a.m. in the morning.
Hmm.
Till 12, they do the work. After 12, they have full time to do PG course
Hmm.
or some other subject. They
Yeah.
can do other course,
Yeah.
right? So your
Yeah.
scope is huge. Like I said, there's a huge demand for the skilled manpower. As of now, only America outsourcing work to India. Shortly,
Hmm.
Australia, Canada going to outsource to India, and India is going to start coding very shortly. Private
Hmm.
sector. So
Hmm.
automatically, demand is very, very high.
Demand is, yeah. Yeah. Thank you, Dr. Santosh. It was a really fruitful and enriching session with you. Thank you so much for joining us.
Thank you, sir. Thank you,
And
Harish.
you,
Thank you,
and
bye-bye,
you
sir.
stay tuned for more updates on Power Corridors. Thank you.
Thank you, sir. Thank you.